If you run a medical or dental practice, you've probably had the same hesitation about AI that a lot of your colleagues have. Is this even safe? Am I one wrong click away from a HIPAA violation? It's exactly the right question to ask, and the honest answer is this. AI can absolutely be used safely in a practice, but only if you understand a few specific lines you cannot cross. In the next few minutes, I'll walk you through what patient data actually is, the single biggest mistake practices make, one word that separates a safe tool from a risky one, and the short list of questions that tells you whether any tool is safe to let near your patients. No legal jargon, just the parts that matter. Before we get into the rules, let's be clear about the stakes, because there are two of them, pulling in opposite directions. On one side is the risk everyone thinks about, a HIPAA misstep. A breach involving patient data isn't just embarrassing. It carries real financial penalties, mandatory reporting, and the one thing a practice can never fully rebuild once it's cracked, which is patient trust. So caution here is completely justified. But there's a second risk that gets almost no attention, and it's just as real, the cost of doing nothing. While you're hesitating, the practices around you are quietly using automation to answer patients faster, cut no-shows, and give their staff hours back every week. Sitting out isn't actually the safe choice, it's just an invisible one. So the goal of this video isn't to scare you away from AI. It's the opposite. It's to give you the handful of rules that let you use it confidently, so you're not stuck choosing between compliance and progress. You can have both. Let's start with the thing almost everyone gets a little wrong, because it's the foundation for all of it. Protected health information, PHI, is not just diagnoses and lab results. Under HIPAA, it's any information that can identify a patient and is connected to their care. And that's much broader than most people expect. A patient's name on an appointment list is PHI. Their phone number attached to a reminder text is PHI. A birth date, an address, an email, even the simple fact that someone is a patient at your practice at all, once it's tied to a person, that's protected. It isn't the medical detail that triggers the rules. It's the identifiable patient. Here's why that matters for AI. The moment any of that information touches a tool, that tool is now handling PHI, and it has to be handled under the rules. So the mental switch to make is simple. Stop asking, is this medical? And start asking, could this identify one of my patients? Get that one distinction right, and everything after it gets a lot clearer. Now, the single biggest mistake I see, and it's an easy one to make with the best intentions. Someone on your team is trying to save time, so they open a free public AI tool, the consumer version of ChatGPT, say, and they paste in a patient's message or a chart note or an insurance letter to get help rewriting it. It feels harmless. It is not. When you use the free consumer version of an AI tool, your data can be used to train that company's models. And there is no agreement in place protecting that patient's information. You've just handed PHI to a vendor who never promised to safeguard it. That right there is the line you don't cross. But here's the flip side, because I don't want you walking away thinking AI is off limits. The exact same underlying technology, accessed the right way, through a business account under a signed agreement, configured so your data is never used for training, is perfectly appropriate. Same tool. Completely different risk. The difference was never the AI. It's the agreement and the setup behind it. That agreement has a name, and it's the most important word in this entire video, a business associate agreement, or BAA. A BAA is a contract between your practice and any vendor that touches your patient's data, where that vendor legally commits to protecting it the same way you're required to, safeguarding it, limiting how it's used, and reporting immediately if there's ever a breach. Under HIPAA, if a vendor handles PHI on your behalf, that BAA isn't a nice to have. It's required. And here's the part that will save you more than anything else in this video. A company can put the words HIPAA compliant all over its website, and on its own, that means almost nothing. Marketing language is not a contract. The real test is one simple question: will you sign a BAA with us in writing? If the answer is yes, they're standing behind their claim. If they dodge it or tell you that you don't really need one, that is your signal to walk away. A serious healthcare vendor fully expects to be asked and won't blink. So where does all this leave you day to day? The simplest way to hold it in your head is two zones: The green zone is where you can move fast and worry far less. Anything that doesn't involve real patient data is fair game. Drafting template messages, building and testing a workflow on made-up sample data, writing up your policies, doing general research. That's exactly what I do in the demos on this channel. Everything runs on mock data, so there is no real PHI anywhere in it, and nothing I show would ever touch a real patient's record. The red zone is where the rules switch on, any real patient information flowing through a tool. And red zone does not mean forbidden. It just means it has to run through vendors you have a BAA with on properly configured, secure systems. The mistake was never using AI on real data. The mistake is doing it on a random consumer tool with no agreement and no safeguards. So learn and experiment in the green zone freely and only cross into the red zone once the compliance pieces are actually in place. So before you let any AI tool near your practice, here are the 5 questions that cut straight through the marketing. These are worth writing down, or better yet, grabbing the checklist I'll mention at the end. 1. Will you sign a BAA? We covered this. It's the non-negotiable first filter. 2. Is my data used to train your models? You want a clear, unambiguous no. 3. Where is my data stored and is it encrypted? You're listening for encryption both in transit and at rest. 4. Who on your side can access my data, and is that access logged? A serious vendor tightly controls and records whoever touches PHI. And 5. What happens to my data if I leave? You want to be able to get it back and have it permanently deleted. You don't need to be technical to ask any of these. You just need to ask them and then notice whether you get straight answers or a cloud of sales fog. The good vendors will actually respect you for asking. The ones that squirm just told you everything you needed to know. Now, if that list felt like a lot, the BAAs, the hosting, the encryption, the access logs, that reaction is completely normal, and it's actually the whole point. Setting up AI so it's genuinely compliant and keeping it that way as tools and rules change is real, ongoing work. It's more than a busy practice owner should have to shoulder alone, and it's precisely the part most people get wrong. That's exactly what we do. We handle the compliance setup end to end, whether that's a properly hardened self-hosted system or a healthcare native platform that's built to be HIPAA compliant from day one. You get the time savings of automation without personally becoming your practice's compliance department. So here's the honest bottom line for the whole video. The technology is ready. Using it safely is a solved problem. It just has to be done right, and done right, it's not the scary part. It's the part that finally gives you your hours back. To make this easy to actually act on, I've put together a free HIPAA-safe AI checklist. The 5 vendor questions from this video, plus a plain English summary of what a BAA needs to cover, so you can vet any tool before it touches your practice. The link's in the description. If you'd rather have the whole compliance setup handled for you, you can book a working session on that same page, and we'll look at where AI fits in your practice and how to do it safely. Either way, subscribe, because I break down one of these practice automations safely in every video. When I build on a platform that's HIPAA compliant out of the box, I use Jargon, link in the description. Quick disclosure, they're an affiliate partner, so that link supports the channel. And if you want to see one of these workflows actually built end-to-end, watch my AI front desk video next. It's on screen right now. See you in the next one.